My name is Samantha Welch. I have been a patient of Dr. B's for about a year now, and I came in for an explant surgery. So I started to do some research into who actually even did the surgery. It wasn't a well-known thing. Even today I'll say I got explant surgery and not a lot of people know what I'm talking about. So I had a couple consultations scheduled. I actually had Dr. B scheduled first. After I met with him, he made me feel completely at ease, and I knew this was my guy. I canceled all the other consultations I had. I ate the consultation fees. I was like, I don't need to talk to anyone else. He was just so intelligent and confident in what he was saying, and I just felt an overall like calming vibe from him. So when I came in, we talked about the options, where we were going to go from here. I told him I'd never really considered complete removal, and he told me, this is a surgery that is popping up more so than ever. He's doing, I think, even more explant removals or implant removals than he's putting them in at this point. But my experience from start to finish was one that I'm very grateful for. The staff were very accommodating. I called a lot. I had a lot of questions. I wanted to make sure, I was covered on all fronts. I was doing all the things I needed to do. Aside from the staff, Dr. B, again, was just so informative. The fact that he had the personal touch of I would email him and I would have a response the same day. I would even be brave enough to text sometimes when I'd have a serious question, and he, again, would just get back to me. And I feel like those personal touches are what makes you kind of get on the same level, because I think sometimes when people are interacting with doctors, they kind of get a sense of, this person's smarter than me, I should listen to whatever this person's saying. But Dr. B was very much wanted to get my side of things, wanted to know how I felt about things. It wasn't so much just this is what I think we should do and this is what we're doing. I was very much involved in the process. He really gained my trust when he talked me out of doing fat grafting, because I came into this thinking that I was absolutely going to do fat grafting. I was like, there's no way I'm going to be satisfied with my natural breast size. But he informed me that it was a very unsafe procedure and that we should just kind of take things slow. So to me, that just spoke volumes, because there's not a lot of places you'll go in wanting to spend money and they'll say no. Let's stop here, let's take things one at a time and see what happens, versus other experiences I've had in my past, they just kind of take the money and ask questions later.